500,000 Aussies are taking weight loss medications, and while for people living with obesity, it has proved to reduce the risk of chronic disease such as heart disease and type 2 diabetes, experts are warning about the long-term implications of the drugs.
Yeah, among the side effects are declining muscle mass and an alarming deficiency in a range of nutrients essential for good health. So what can you do to keep your health on track while taking these medications? Well, to tell us more, we welcome back dietitian and CEO of Food Watch, Gemma O'Hanlon. Morning to you.
Hi, Gemma.
Explain to us, what are these fat loss medications first?
So these medications simply mimic a normal pathway that our body has. So our body produces a hormone called GLP-1. So what that does is when we eat food, it helps to regulate our appetite, manage our blood sugar levels, keep us fuller for longer. These drugs amplify that. They bump that effect up a lot. So essentially we're going to be eating a lot less food because we're not hungry. We, our appetite becomes really suppressed, and these weight loss drugs can lead to significant weight loss, about over 20% of weight loss, which is quite a lot for people. So they can help to reduce the risk of chronic conditions. They can be safe and effective, but we do need to consider some of the nutritional aspects to ensure that we stay well nourished.
Okay, so what are the downsides? So we're not eating as much, we're not hungry. Therefore, we're not getting the nutrients. What are the downsides?
Yeah, so the biggest downside, so weight loss is one outcome, but what is the quality of the weight loss? So how much lean muscle mass are we actually losing when we're taking these drugs? And it can be between 20 and 40% of the weight loss can be that lean muscle mass. That can impact our metabolic rate, it can impact our mobility and strength, it can increase our risk of a fall or fracture later in life, and overall it can lead to malnutrition. So we don't want to
just affect the fat? Can't it just...
No, it can't. Generally, people lose a lot of muscle mass on these.
So you sort of become like a bit skinny, fat kind of thing?
Yeah, it's just that... we can become frail. And so the thing is, there's things, though, we can do with nutrition and exercise to help to maintain that muscle mass.
Okay. What can they do?
Well, protein is really important. So think of protein as your preservation agent. So protein-rich foods are really important to maintain muscle mass. And also, 2 to 3 times a week of resistance training is really important to combine with that protein. We need even more protein. So when we are eating less, right, the small meals need to be more frequent, about 6 times a day, small frequent meals, because we don't feel like much. And protein, prioritise the protein.
Protein dense.
First on the plate.
For example.
So even a smoothie is great. So smoothie ticks the box for protein. You might make it with milk, some milk powder, even a piece of fruit thrown in there.
Protein powder?
Exactly.
Yeah. Okay.
Boosts of protein and hydration as well. Cottage cheese is fantastic, good source of protein. Fish, meat, fish, chicken, eggs, excellent source of protein, Greek yogurt, and even, for vegetarians, tofu. There's 20 grams of protein in a serve of this.
So you're not hungry, but if you are hungry, have some tofu. Have some cottage cheese. Okay.
Doesn't that sound sad? If you're hungry, have some tofu.
If you're not hungry, maybe you're just grabbing a piece of toast, and that's not enough.
That's not enough. Okay.
So maybe you have some scrambled eggs on toast, and then you're getting more protein.
Gem, dehydration as well, that'd be an issue.
Yeah, that'd be an easy one to fix.
Well, so interestingly, when we're on these drugs, so our foods and our fluids stay in our body for longer. Digestion is slowed, gastric emptying is slowed, so we don't really feel like drinking fluids either that much. So dehydration is actually quite common. So 8 to 10 cups of fluids a day, water, tea, coffee, of course, but then think about your other hydration needs. So things like soups. This chicken soup is fantastic because that's got 14 grams of protein in that. Fluids and vegetables. Watermelon and cucumber have over 90% water content, so they're great as well.
Great.
Wow. Gee, I'm hungry and dehydrated. I'm going to grab some cottage cheese and a cucumber.
And the other thing to consider as well, I think when someone is prescribed a weight loss medication, they should also be prescribed a referral to an accredited practicing dietitian, because a dietitian can help people make sure they're getting what they need in the small amounts that they can
while still losing weight as well.
You know what? It's super important because people may be just jumping on the drugs without giving a lot of thought to this side of it.
It's so important to stay nourished when we're on these drugs.
Thanks, Jem. Thanks for explaining.